This is TTT Live. I am Stacey Ann Providence. The Ministry of Health is hosting a virtual press conference to give us an update on the status of COVID-19 here in Trinidad and Tobago. And we're bringing you live coverage on TTT and Talk City 91.1 FM on Facebook, Twitter, Instagram and YouTube at TTT Live Online. We go now to Minister of Communications, Donna Cox.
Hello and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, Dr. Adish Surju Singh, the Director of Women's Health at the Ministry of Health, and Yvonne Lewis, the Director of the Health Education Division, Ministry of Health. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good afternoon to Trinidad and Tobago, ladies and gentlemen of the media. So we start off today with the briefing on where we are with COVID-19 as part of this global pandemic. To date, there are approximately 1,835,474 cases worldwide. So we are approaching the 2 million mark very soon. We have had globally 113,191 deaths, very unfortunately. What is our local situation? To date, we have sampled 1,141 swabs. Of that, we have a positive result of 113. And when we take off the anomaly, which is the cruise ship group, which is 52, we are left with a positive case index of 61. To date, Trinidad and Tobago has registered 8 deaths, 7 in Trinidad and 1 in Tobago. And again, our heartfelt condolences go out to those 8 families. And to date, discharged 16. What is the situation at the nation's hospitals as we deal with the global pandemic? Cora at present, we have 14 patients, all stable. In Couva, we have 44 patients, 1 in ICU, stable, not ventilated, 4 in the high dependency unit, stable, and we hope and keep our fingers crossed that that person will be transferred to a step-down ward very shortly. And we have 39 patients who are up and walking, what we call ambulatory. At the Sangre Grande facility, we have 31 patients who are asymptomatic, low risk, and stable. It is now my duty to deal with the issue that has occupied the public's attention over the past 24 hours as to what is happening with Sangre Grande. The RHAs have devolved authority to choose facilities for this purpose, to combat contagion and to play our role in this global pandemic. The issue of what happened in the first 24 hours up at the Sangre Grande facility came to my attention very early yesterday morning. As Minister of Health, with ultimate responsibility for the entire health sector, we took immediate action to institute immediate remedial action and to give the option to the patients of being moved. We also instituted an immediate review as to how this site was chosen and how other sites are being chosen, and to make sure they are fit for purpose so that we could prevent a reoccurrence of this. Strangely enough, before coming on air, I was able to speak by telephone, on speakerphone, with 26 out of the 30 residents at that facility, because we gave them the option to move. They have indicated that under no circumstances are they prepared to move, but they have also indicated that they want a chance to tell their story to the media, and we will arrange that. They have indicated, because I spoke to them, we put the phone on speakerphone. There were about 20 people around the speakerphone. I spoke to them personally. They are quite more comfortable with the actions taken to upgrade the facility, and they have no desire to be moved, even though the option was given for them to be moved. I have also asked the chairman of the Eastern RHA to report to me as minister within 48 hours as to the circumstances that led to the choice of this facility, why it was not up to scratch within the time frame, but at the end of the day, in having responsibility for the entire health sector, we took immediate action from yesterday to ameliorate the conditions at that facility. And as it stands now, the patients have not indicated that they are taking up the offer to be relocated. They have indicated to me two things. They want to tell their side of the story to the media, and we'll arrange that. And they are quite prepared to stay the rest of their quarantine period under the present conditions for which they feel comfortable. What we are also doing with those patients, because part of the story today was about confinement, about claustrophobia. These are real issues. These are real psychological issues. And as of yesterday and today, we have instituted individual psychological counseling because these people have been through hell and back. They did not bring this upon themselves. But what they don't want is to be scapegoats and to be ostracized. And they want a chance to tell their side of the story. So, the actions taken to date, an immediate investigation has been launched by the chairman of the board of ERHA to report to me within 48 hours. Immediate remedial works were done yesterday. The patients are now much more comfortable, and they have said to me directly they have no desire to move. They have praised the care that they are getting, the nurses, and they are perfectly comfortable where they are. But the option is always there, and they have chosen not to exercise the option to move. I will be more than happy to answer any questions to deal with the issue of Sangre Grande, but that is the current situation as it stands right now. Thank you very much.
Thank you very much, Minister. At this time, we'd like to ask the Director of Women's Health at the Ministry of Health, Dr. Adish Surju Singh, who will now speak on COVID-19 and pregnancy.
Thank you, Honorable Minister of Health, members of the media, ladies and gentlemen. A very pleasant good afternoon. Just over a week ago, one of our senior doctors, Dr. Salian Ishmael, who is the acting head of the Department of Obstetrics and Gynecology, would have spoken to you on COVID-19 in pregnancy. We have noticed still that there are some concerns from our pregnant population, and we have observations that some persons are still not heeding the advice given. We would like to reassure the pregnant population that being pregnant does not increase your risk over the general healthy population. You will understand that the information is dynamic, it's evolving, and it's based on international publications. We have noticed also that we have reports coming out of the epicenter of this epidemic, which is New York, recently reported that in the pregnant population, 86% of their cases in pregnancy were very mild, 15% required hospital admission, and unfortunately 5% needed intensive care. Reassuringly, however, as up to last Friday, there were no maternal deaths reported throughout the world in the medical literature. For healthy women, the message is that you should be fine. However, there are certain women who will be placed in a higher risk population. Of course, these include cases we have already discussed. If you have heart disease, lung complaints such as asthma, high blood pressure, diabetes, and any other condition that compromises your immune system. What have we been doing in Trinidad and Tobago? We want to ensure that antenatal clinics, postnatal clinics, and our newborn services continue. Attending these clinics are critical to achieve a good outcome for mothers and babies. There will be some disruption. There will be some inconvenience. You need to bear with us. We are trying to protect you, your unborn baby, and your family, as well as the health system. Follow the advice you have already heard about wearing your mask, not assembling unnecessarily, and so on. Now, if you are unfortunate to get the COVID-19 and you are pregnant, there are certain things you need to know. 1. The medical literature continues to be reassuring. There's no significant evidence of transmission of the virus from mother to child during pregnancy, during labor, during delivery, nor if you choose to breastfeed your baby. And we are advocating for you to breastfeed your baby. It will give that added boost to the immune system of your baby. In terms of the data again, we have not seen any short-term ill effects to the baby, nor to the pregnancy in terms of things such as miscarriage or preterm birth. Now, if you are pregnant and you do not have an obstetric emergency, you will be sent to one of our COVID-designated institutions. There are several of them, and these include Couva, Cora, and there are other facilities. Now, if you happen to have any need obstetric-wise while you are there, we have specialist doctors available 24 hours a day, 7 days a week, who are able to provide advice. Now, if you need to deliver your babies, a service has been set up at 3 of the public hospitals: Mount Hope Women's Hospital, Port of Spain General Hospital, San Fernando General Hospital in Trinidad, and in Tobago at the Scarborough General Hospital, where we can cater for any obstetric or gynecological emergency in a suspected COVID-19 patient who is either suspected or confirmed. And everything is being dealt by on a case-by-case basis. I have a special message for patients who are after 28 weeks of pregnancy. Now, we are putting these persons in a slightly higher risk simply because we do not want you to get the infection, of course, at any time, but certainly not close to the time of delivery. So, especially if you are a frontline worker, for example, some healthcare professionals, I would advise you to not be in the front line when you're caring for patients. You need to speak to your employers at this time. Family planning and sexually transmitted infection clinic and services are still being conducted. These are available at all of the regional health authorities and the Ministry of Health facilities. The numbers for all our services are listed on the Ministry's website. In closing, I would like to reassure the population that our maternity and newborn care services are functional and our highly trained staff are fully equipped to provide a high level of service despite the threat of COVID-19. I would like you again to follow official sources of information from the Ministry of Health. Lastly, I would like you to stay home, stay safe, and save lives. Thank you very much.
Thank you very much, Dr. Sergio Singh, the Director of the Health Education Division, Ministry of Health, Yvonne Lewis, will now focus on guidelines for homes for the aged.
Thank you very much, Minister Cox. Honorable Minister of Health, Minister Dayal Singh. The Ministry of Health developed a COVID-19 preparedness and response plan along with infection prevention and control guidelines for homes for the aged and long-term care facilities as part of its COVID-19 response strategy. Persons in home for the aged were identified by the ministry as a vulnerable group because of their age, underlying health problems which make them more susceptible to severe illness from COVID-19. These guidelines were developed by the Ministry of Health's technical team, supported by PAHO WHO in Trinidad and Tobago, and contain standards of practice approved by the World Health Organization to reduce risk of COVID-19 in long-term care facilities. The objectives of the Ipc Guidelines are twofold. One, to prevent and reduce risk of infection with COVID-19. And secondly, to facilitate early detection
and prevention of transmission of the disease within a facility. In this regards, the guidelines detail critical infection prevention and control measures, including updating of staff on those very said guidelines and doing routine checks and auditing practice to ensure that they are implemented. Promoting personal prevention measures that the ministry has been sharing for a while now in terms of hand washing, cough etiquette, social distancing, etc. within the facility. And in order to do this, maintaining a supportive environment with so that the preventive measures can be practiced. So the supportive environment will include frequently cleaning, frequently touched surfaces, ensuring that there are enough consumables for hand washing, implementing measures to maintain social distances within the facility. Another measure is with respect to reducing risk of introduction of the virus into the home by persons coming into the home. And so this will include things like instructing all staff who are ill with flu-like illness to stay at home and do not report for work. At this time, not allowing visitation by persons outside of the facility except when it is absolutely essential, probably by some healthcare provider. Placing hand washing stations at the entrance to a home to facilitate hand washing before staff enters the facility. These are ways to prevent the virus from getting in. And finally, closely monitoring residents who already have underlying health issues and ensuring that they receive their medication and prescribed diet, etc., on a timely basis. And this is to enable them to maintain optimal health, because being controlled is one of the defenses. So these are just some of the preventive provisions. The guidelines details very much more of these, and you can see them. They have been published in the newspaper. Regarding the second objective, which is prevention of transmission, the guidelines contain a daily COVID-19 symptom log for both residents and staff to use in monitoring and tracking symptoms associated with COVID-19. That would be fever, cough, shortness of breath, and to do this on a daily basis. It also provides contact information for notifying the county medical officer of health immediately if a resident develops these symptoms. This is to activate the public health response, which will then be guided by the CMOH. And the public health response will include any necessary testing or access to the continuum of care that is available through the public health system. It also details isolation procedures to be implemented and use of PPE to reduce transmission to others in the case there is a person with COVID-like symptoms in the facility. Now, the ministry has been working steadily on this initiative from the event of COVID-19. The ministry has circulated these guidelines to all homes for the aged and residential care facilities in the known databases that we have. And we have databases from the Ministry of Health, the Ministry of Social Development, Division of Aging, and homes that are part of the TTRCA, which is a residential care association. They have also been circulated to all CMOHs, the National Nursing Administrator, and through them to the members of the public health team all through Trinidad and Tobago, who is involved in implementing the ministry's COVID-19 public health response. They've also been published in the national newspaper so that the wider public will have an appreciation of what we're doing. Thank you very much.
Of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. Do remember we have expanded the pool of reporters to give as many of your colleagues an opportunity to pose questions to us. But that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. Let's keep this in mind as we begin taking your questions. 98.1.
Good afternoon, Minister. And
Good afternoon, Mr.
Good
Cummins.
afternoon.
Happy holidays, happy Easter. Just 2 quick questions. Minister Singh, are we seeing any noticeable change in the behavior of the virus as of today? I read, for example, where experts are questioning as to whether the 14-day quarantine period should be reviewed or expanded to ensure better monitoring, testing, and diagnosis. My first question. And the second question is, are registered midwives classified as among the first responders as they also focus on pregnant women?
Thank you, Mr. Cummins. So the Chief Medical Officer, and I wouldn't like to repeat his technical advice, he spoke about this yesterday when he said that 3 cases in Balandra have actually come back positive after 14 days. You may remember, Mr. Cummins, at one of the earlier press conferences, I did say what we don't know about this virus is probably more than what we know. It's an evolving situation. And that is why, out of an abundance of caution, we have instituted the protocols to deal with this. And this is, again, in speaking to those patients up in Grandy just now, before I came on here, their biggest concern is they want to go home. And I could understand that. They say they are dealing with isolation, loneliness, unfamiliar surroundings. And these are the reactions you get when people are isolated. You and I are isolated at home. And we are jittery. Far less for people who have contracted this disease through no fault of their own. So we continue to watch the evolving epidemiology. We have 3 cases in Trinidad, which the CMO spoke about, that we now have to probably seek international assistance with. We are in touch with people from Vancouver, Louisiana. I'm in contact with people in the UK, Vancouver, to see what their experiences are. And that is why the message still has to be to stay home. Because we don't know. There's so much that we don't know, Mr. Cummins. And I want to thank you for that question.
Permit me to answer your question related to midwives. Let me just simplify the answer and say, yes, of course, they are first-line responders. But for every COVID-19 patient we see, there are many persons at the front line who have to look after this patient. And these include registered midwives, attendants, specialist doctors, interns, nurses, nursing assistants, cleaners, scrub technician, anesthetists. There are many staff, and sometimes we have to duplicate the number of staff looking after one patient, and sometimes triplicate, which compounds the problem when we are dealing with COVID-19 patients.
Thank you very much. News source.
Hi.
Hello, Rhoda.
Good afternoon to the panel.
Afternoon.
I've got questions for Minister Singh. Just 2 questions.
Sure.
One, if you do have the details, any of the details at hand, if you can talk us through this, the selection and the sanitation process for these facilities, and how can members of the press make contact with the convalescent patients that are willing to speak to the media?
So the selection and sanitation process is under the control of the particular RHA. So they will choose the site. And then each RHA has what is called IPC units, Infection Prevention Control Units. And they will sanitize the sites. They will sanitize hard surfaces, floors, beds, linens, everything. And that is the procedure that we use. That has always been in place, but because of COVID, you may have to alter it depending, because we are dealing with a new virus. So that is how the sites are selected, and that is how the sanitation is done. And offline, I wouldn't like to give the person's number online. We will certainly make it available for you via our corporate communications department, because they have indicated that they would like to give their side of the story.
Okay, have you answered both?
Yes.
Okay, good. We go to Guardian Media Limited, Annalisa. Annalisa?
Hi, good day, Minister.
Good afternoon,
Good
Annalisa.
afternoon.
Minister, I know that you said that the sites were selected by the RHAs, and you had also assured us that proper checks and balances were being done. At this point, are you saying that the RHAs are the ones who have the authority to select the sites? Now, the patients have indicated they are not ready to be moved, and therefore, how do we ensure that this does not happen again moving forward? One, and two, can you say whether or not this is a state-owned facility, or if they, how much the ministry is actually paying for this now, and what can we do? What is going to be done now
Sure.
regarding the movement forward?
Yeah, so those are relevant questions. So the RHAs, in law under the RHA Act of 1994, they own and control facilities. They have a process to select facilities outside for their use. So the ERHA would have done their site visit. I am assured by the Chief Executive Officer the place was sanitized before. And that is why I've asked the chairman of the board to conduct an investigation, which he will give me a report in 14 hours to do just what you are suggesting. Make sure that this does not happen again. We have to do that. We have to do better and make sure that this does not happen again. We have to learn lessons as we deal with this global pandemic. Okay? Thank you very much.
Okay, I have a question. I don't know if it's for the minister or for Dr. Serju Singh. The person online wants to know if we should be doing more testing.
Okay. So, Dr. Tedros made a statement about a month ago and he said test, test, test. But everybody took that and did not read the third paragraph down. He said test, test, test. And when you read the third paragraph down, suspected cases. It is not good protocol to just go out and test 1.3 million people here or 361 million people in the United States. You test, test, test on suspected cases, known contacts. That is what we have been doing from day one. What we are doing now, as indicated earlier this week, now that we know the virus is circulating in Trinidad and Tobago, we have expanded our testing to include something called surveillance testing, where one health center per county will now be testing randomly, and let me explain what randomly means. It doesn't mean you walk in there and you get a test. We will be selecting a certain number of people who are presenting with signs of viral illness, swabbing them and testing them to see how widely spread any virus that is in the country now, whether it's H1N1, influenza B, or coronavirus, is presenting itself. That is a more active form of testing versus waiting for people to come to be tested. So Dr. Tedros did say test, 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 but everybody focused on that and did not focus on the third paragraph. Test, 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 yes, but amongst your suspected cases. We have done that, and now we are widening the pool to see and do what is called surveillance testing. I hope that answers your question.
Thank you, Minister. Express?
Hi, good day. Suzanne Mohammed, Trinidad Express.
Hello.
Good day.
Minister Dialsing, can
Yes.
you say what those photos that were sent to the media this morning?
Yes.
RHA, are they from the San Grande facility?
Hold on, there's a background noise. Do you have to take down your volume?
Sure.
Okay. Could you repeat your question, please?
Yes. Is this okay?
Yes.
Is this okay?
Yes. Yes, go ahead.
Okay. Yes, Mr. Dialsing.
Yes.
So the question is, were the photos that were sent to the media this morning by the ERHA, were they from the San Grande facility? And also, in the event of there is a ramp up of testing, can you give us some more information about the areas and the process?
Yes, so the photos, I believe, are from ERHA. They sent that out. I had no control over that, so I assume that they are real. And you want to know about the testing? How are we ramping up the testing? Just repeat the second part, please.
if you say that you're going to ramp up the testing by the state this week, can you say where it's going to be done? And
Oh, sure. Yeah. So we are selecting one health center per county. So, for example, St. George West, we select one. St. George East, one. Victoria, one. Caroni, one, and so on. So you select one per county under the administration of the County Medical Officer of Health. And what we'll be doing is asking people who present with flu-like symptoms, fevers, coughs, runny nose, offering them the option of volunteering to be tested. So we start to collect some data which will then be fed into the national system to help us make projections, help us make better management decisions as we manage our part of this global pandemic. So those are the mechanisms, and the chief medical officer will decide how many samples per day, per county, and so on. But that is the general strategic intent to help us get more data, to help us make better management decisions as we go ahead with our second and third waves of this virus. I hope that answers your question, Susan, and thank you.
Thank you. I-95.5.
Good afternoon to everyone. This question, my two questions actually for Minister DLC.
Yes.
To the I-95.5 anyway.
Hi.
As you were speaking about data a while ago, my first question has to do with the fact that we are seeing reports of persons testing positive, going through the whole process, recovering, and then testing positive again. Are we going to be continuing to monitor our positive patients after they are discharged to try to gather more data to better understand the epidemiology of this particular virus? I know it's early days yet.
Yeah. So first of all,
I'm wondering if that's an option that you will be seeking to undertake.
Okay.
And my second question, you have said repeatedly that the country has an adequate stock of PPE.
Yes.
And there are systems in place should we need more to get more. The Trump administration would have instituted a procedure whereby they are now blocking the export of PPE outside of the US. How likely do you think that is likely to impact on our ability to acquire PPE should this particular situation persist and we actually need to get more PPE, let's say later down in the year?
Okay, thank you. So you started off by asking if we are going to follow up positive patients after discharge. So first thing, we don't discharge positive patients. We only discharge negative patients. No positive patient is ever, no known positive patient will ever be discharged. We only discharge negative patients. And just reiterating what the CMO says, you get 2 negative tests 24 hours apart. Once you get that, you satisfy the first hurdle, and then you go home, and then you further self-isolate for 7 days. So I hope that answers the first part of your question. On the issue of PPE and the embargo from the Americas, Trinidad and Tobago, like all countries in the Americas, which includes from Canada, United States, Central America, and right down to Chile and Argentina, we are part of what is called the Americas region. And we source PPE via PAHO through the Americas. So any country in South America, Central America that is making PPE, we can get from them. We also source PPE from other parts of the world, China, India. Right now, as we stand, I had a meeting, I think I indicated this last week, with NIBDEC and our principal pharmacist who is doing a wonderful job behind the scenes. We have absolutely no problems with PPE. However, as I keep saying, if this thing explodes, and I gave some data some time ago, it takes 1,187 pieces of PPE to treat one COVID positive patient for maybe a week or 2 weeks or 3 weeks. If we get a second or third wave, which is tsunamic in proportions as opposed to this first wave, it means we would have been in a bad place. And that is why the solution to all of this, PPE, drugs, is to stay home so we don't crash the system. And that is why the message from the Prime Minister come down has always been to stay home so we don't have a run on PPE. What is noteworthy is that India, which is a source of pharmaceuticals, drugs, and swabs, has wisely and luckily lifted its embargo. So more and more things are coming in from India, including things like swabs and so on. So right now we're in a good place. Thank you, and I hope that answers your question.
Prior.
Hi, good afternoon all.
Good afternoon, Prior.
I just have a question for Minister Diyal Singh.
Sure.
Minister Diyal Singh, at azbnews.com, we have a columnist, right? She is a Trinidadian who lives in Italy, Miss Bunny Khan, and she writes a diary for us. She had reached part 9. One of the lessons she said that we should learn is that Italy didn't learn the lessons from Wuhan, and then the rest of the world didn't learn the lessons from Italy. And the lesson is lockdown. When Italy had their first 14 days of lockdown, people didn't really pay attention, and there was an exponential growth in the spread of COVID-19. It's so bad now in Italy that only one person...
You have a question?
Yes.
What is the question, please?
I'm just asking the minister if it is that we should, since you spoke about the first wave and the second wave, if you think that now is the time for us to have a more stringent lockdown in terms of stay-at-home measures.
Okay.
I was just trying to get
Sure.
to let you and give you an idea about how people are not paying attention to
Yes.
what happened elsewhere. So
Okay.
Should we learn the lessons there?
Yes.
That is the question I want to ask.
Sure. So we learned lessons way back in January. If you recall prior, Trinidad and Tobago was probably the first country in the Western Hemisphere on January 30th to impose travel restrictions on people coming from China. Then we subsequently added 5 other countries. Then we subsequently added 3 countries. Then we suspended the rest of the cruise ship season. All these were gradually to increase our response to COVID. We were one of the first countries to do this, and we were criticized for it. We have instituted the social distancing. We have instituted hand hygiene, face hygiene, cough etiquette, washing hands. It's more than lockdown. It's how do you change the behavior of people? How do you change the behavior of people to deal with this COVID response? So Trinidad and Tobago, in my view, and in the view of the European Union, because they did a piece in the Express which says, and I have it here, they are more than impressed with Trinidad's response. And then if you read EU praises TNT for handling of pandemic, if you read Professor Ramesh Diosaran in yesterday's Express, he's an independent voice. He gave the government 9 out of 10 for the way it handled the crisis. So the government, led by the Prime Minister, has been taking gradual steps, but serious steps, to manage and mitigate the risk. So far, so good. Thank you very much, Prior.
Thank you. We go next to TV6.
Hi, good afternoon, everyone.
Hi, Urvashi.
You all. Hi.
Good afternoon.
Good afternoon. So my first question to Minister Diyal Singh would be relating to healthcare workers. I'd like to know how many healthcare workers have been infected or tested positive for COVID-19. Has an investigation been launched to determine what led to their exposure in order to prevent future exposure? And of course, is the testing of healthcare workers routine? Secondly, Minister Cox, you were completely right that there's been an overwhelming request by media persons to even join in this conferencing. It has come to our attention that DNN Network, among others, have requested to be included. So they're asking what is the criteria for inclusion. And as you all may know, one Mr. Devan Maharaj is responsible for DNN Network, and he's contemplating legal action. Thank you.
Okay. So I will take the first part of the question. Yes, so the Chief Medical Officer at a previous press conference did indicate that to the best of his knowledge, 2 persons, 2 healthcare workers, were in fact tested positive for coronavirus. I think one is a medical doctor in Tobago and one is a medical worker in Trinidad. I think those 2 cases are under investigation with all the contact tracing, and that information will be shared with them. But we will have to learn lessons based on what we know could be the source of the infection. And yes, we are ramping up testing for healthcare workers. We treat them as a special high-risk category for special treatment. Thank you, Urvashi.
Thank you very much. Urvashi, you mentioned, what was exactly your question? You made a statement, but what was the question?
Just requesting the criteria for inclusion in the conferencing, and of course, was there any particular reason that DN Network or DNN was not allowed entry?
Okay, I wasn't aware that they had made a request. Actually, I saw a letter on Facebook speaking about him wanting to get in and with some legal, jargon in the letter. But I'm not aware that a formal request was made. I will check on it. Astronaut Health News next.
Hey, good afternoon, everyone.
Good afternoon.
Good afternoon, Gwyneth Stewart from Astronaut Health Newspaper. I'd like to direct my question to Dr. Yvonne Lewis. So we have heard that persons with underlying health issues have compromised immune systems and they easily succumb to the disease. So I want to know, in addition to sanitization and isolation, do you, Dr. Lewis, believe that having a strong immune system would aid in the resistance of COVID-19? And what are some of the ways you would advise citizens to boost their immune system? And would these practices be applicable to healthcare providers at the various centers as well?
For that question, I think earlier on in the press conferences, the Chief Medical Officer indicated that a healthy immune system is one of your defenses generally for any disease. Right now, I'm working with the Pan American Health Organization to develop some material on chronic diseases and COVID-19. PAHO did release some information on that, but worldwide what we're seeing is that persons who have underlying health issues like diabetes, heart disease, hypertension, they seem to be more susceptible to more severe illness and negative outcomes. And so what that is saying to us, one of the things we need to do, all of us who have underlying health issues, is to pay attention, do the things that have been recommended by your medical team, your doctor, your nutritionist, etc. Make sure to take your medication on time. Make sure to keep up with your dietary practices and the other things that you need to do to control, because a person who has their diabetes or asthma or whatever the underlying health issue is, who has it under control would be less susceptible to the negative outcomes. And so that's the same for older persons. And it's a part of the guidelines that in the homes, they pay specific attention to persons who have underlying health issues and ensure that they get their medication on time and that the other non-pharmacological management measures, those would be things that don't involve medication, things like your diet, that is strictly adhered to. And that is going to be one of the ways that we could reduce our risk of severe illness. This does not negate what the minister said. All of us must do that. The hand washing, the cover your cough, the social distancing, etc. That is how you keep the virus from infecting you. The other parts, in terms of what happens if it's in you, if you have a strong immune system, that would be a part of your internal defense. Thank you.
I recognize Newsday.
Hi, good afternoon. Shane Superville from the newspaper here. Question, I don't know if it was directed to either the minister or Dr. Surju Singh. But without getting into too much details, do you or can you tell me if any pregnant women are among those who have tested positive for the coronavirus so far? And the second question would be with respect to global supply chains of contraception, birth control, etc. Are we having any problems on that front, or are we getting a steady supply as usual?
Shane, I'll take the first question, and of course, as you will understand, we are not allowed to give out individual patient details.
And thank you, Shane, to your second part. I am not aware at this time that we have any shortage of contraceptives. I will check, but I am not aware that at this time that we have any shortages. Thank you.
Wire 868.
Good day, Lasana Lightwood, Wire 868.
Hello, Lasana.
Yes. Minister, I was contacted by a registered nurse who's unemployed and wants to go on the front line, and she says that there are other nurses as well. Are there any plans for the registered nurses currently unemployed to assist in battle against COVID-19?
Sure.
And also, could you give some information on the measures taken within facilities to keep patients who are negative from coming into contact with positive cases?
Thank you. So, any nurse who wishes to do this could contact the Ministry of Health. We have 2 deputy permanent secretaries who are responsible for the recruitment of medical personnel to deal with COVID. So feel free to contact the Ministry of Health, the deputy permanent secretaries. Answer to your second part, yes, we try as far as possible, and it has worked so far, to keep negative patients away from positive patients. And that is why in Cora, we were able to send 6 or 7 suspected cases home, which is not included in the discharge criteria because they were never positive. We keep them apart. So those suspected persons are kept isolated and quarantined in Cora until they get their final negative test. So I hope that answers your question, Lasana. Thank you.
Thank you. CLC.
Good afternoon, Yolande Thomas from Caribbean Lifestyle Communications. Minister Dialsing, can you say with the 1,141 swabs, how many of them were tested more than once? And if you can provide an update on the private labs that possibly would have been certified by CARFA to date, if any.
So the patients who are tested more than once will be those patients who were initially positive, and then they are in our care, and they are tested according to the CMO's protocols. They will be tested a second and third time to get their negative test. So those patients will be tested more than once. I gave the statistic a couple days ago because the media was asking how many actual persons were tested. At that time, it was about 1,009 persons tested. And of that, I think 84 or around there were tested more than once. So I hope that answers the first part of your question. The second part, CARFA, PAHO, and the Ministry of Health is working with private labs. Any private lab that wishes to be a part of the national effort, there's an initial questionnaire for them to fill out. Once they pass that first hurdle, then CARFA and PAHO, we have guidelines that they need to comply with to validate the accuracy of their tests, because you remember the chief medical officer on this forum said more than once, many of the test results from the private labs are incorrect. And a false negative test is an absolute disaster, because that person feels they are free of the virus and they go about in public and cause their own pyramid of infections. So once CARFA, PAHO, and the ministry, they are satisfied that the process, the personnel, the tests can stand scrutiny, they will receive the validation to be a part of this national effort of testing. I am not aware right now that any lab has been so qualified. Thank you.
Minister, I have a question to you from online concerning increased testing by CARFA. What is the turnaround time now for the provision of test results?
Sure. So the question is, what is the turnaround time for testing? So we have to separate the turnaround time from the actual test time. It takes a PCR test about 4 hours to run. These are not rapid tests, which are very inaccurate. PCR tests takes about 4 hours to run, but you don't run individual tests. You wait for a batch. So the lead time outside of that 4 hours has to do with getting a batch. Well, first of all, getting a sample, if it's from San Fernando, Tobago, wherever, that takes some time. Then you get a batch. The batch has to be screened. The chief medical officer spoke yesterday about one sample that the paperwork was incorrect. So all these factors will impinge on the actual time from swab, physical transportation to CARFA, paperwork, testing, and results. We try as far as possible to make this available within 24 to 48 hours. So that's the average sort of time we are looking at. Thank you.
91.9.
Yes, hello, good afternoon.
Good afternoon.
Minister Cox and Dial Singh. Good afternoon,
Good afternoon, sir.
Good afternoon.
We're next to 91.9 FM. I just have 2 requests and 1 question, really and truly. The 2 requests are if we could possibly get an update on the prisoners being released, as would have been highlighted by the Attorney General. And also there are calls from the public about PH drivers and other persons who are not a part of the NIT system. They're asking for an update. So I don't know if Minister Robinson Regis will be able to give that particular update. And my question today goes to health promotions. In particular, health promotions, like Minister Dial Singh said, really and truly aims at trying to help with behavior change. And considering that H1N1 is so much a part of our infrastructure and our lives, as you would have said in a previous press conference, isn't it best that we try to make this hygienic lifestyle part of the behavior change? And is the health promotion really and truly looking ahead in that particular direction?
All right, so I will take the first question and a part of the third. The issue of prisoners, I will leave that to the Honorable Minister of National Security to deal with. I have no locus standi there. PH drivers and NIS, NIB, that's a matter for the Minister of Finance and possibly the Minister of Works. Let me just add one thing on behavior change before you go to Ms. Lewis. You know what the conversation in the world is now? That the days of shaking hands are over. Permanently. Even after COVID. The days of shaking hands may be over permanently. The days of social hugging and kissing may be over permanently. So Vern, you have hit the nail on the head, and I turn over to Ms. Yvonne Lewis now.
Minister, you know, this has been one of the times I think in the history of mankind where I'm seeing behavior change happening at a much more rapid pace. Quite often we spend a lot of time facilitating a first learning sensitization and trying now to give cues for action so that people would start to make a change. We use a lot of theories. We look at readiness for action, etc. But at this point in time, what you need to recognize is if we do not change our behavior, we put ourselves, our families, our country, and the sustainability of our way of life at risk. And so, yes, the end goal for health promotion is that we see behavior change, not only at the level of the individual where it must start, but these have to become family practices now. And we need to teach our children. There has to be a new normal for all of us in terms of, we talk about hand washing or hand hygiene, covering your cough, okay, social distancing. I don't think the world will go back the way it was before, but we have to deliberately change some social norms. You know, we say greet somebody in Jesus' name. We now have to learn to greet somebody with a nod, a wave, or a bounce of the elbow. So yes, for health promotion, from a Ministry of Health standpoint, we want to see change, not only at the individual level, but changing of social norms that pervades through the whole society, and it really will create a new social order. I'm beginning to see it happening, and we will continue to work with groups. We have been doing a lot of sensitization of groups. We're going to continue working with groups. The COPCOM is going to continue doing the media part of it, and we're going to try to help each one of us to understand there is a benefit in this for you. There is a risk, but there's a benefit if we change those behaviors. Thank you.
Thank you very much. At this time, I would like to ask the Minister of Health to give us a closing statement.
Thank you very much, Minister Cox, and thanks to Dr. Sirji Singh for bringing the perspective of COVID and pregnancy, very important but unexplored territory, and to Ms. Yvonne Lewis about what we are doing with our homes for the aged. Ladies and gentlemen, our first case of COVID, I think, was confirmed on March 12th. We have passed our month milestone. We have about 113 cases in that first month. That was our first wave. From today, we start to plan for our second wave. The size of the second wave is entirely dependent on human behavior, how we behave as a society moving forward. It's entirely in society's hands now. Will the second wave be bigger? Will it be smaller? Will the second wave be a tsunami that capsizes the whole thing? The Prime Minister, the Cabinet, Ministry of Health, we have done our part and continue to do so. I want to recognize at this point in time, and I don't use superlatives easily, but I want to recognize our world-class healthcare system now, our world-class public health officials, our world-class chief medical officer, the world-class public health people, doctors and nurses, who are helping us manage this event. We can make it easier on them if we as a society stand behind the Prime Minister and the government to do a simple thing. Stay home, stay safe, and may God bless us all. Thank you very much.
Thank you very much. Ladies and gentlemen, we have come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its effort to flatten the curve and beat COVID-19. Stay home, stay safe. See you tomorrow at 10 a.m. and may God bless Trinidad and Tobago.
And that was an update on the status of COVID-19 here in Trinidad and Tobago by the Ministry of Health. And just to give you some of the key points coming out of today's press conference, we heard from the Minister of Health, who updated us on the figures in terms of the number of samples sent for testing, 1,141. Of those samples, 113 were positive. Now, of course, there were 8 deaths in Trinidad and Tobago, 7 from Trinidad, 1 from Tobago, and 16 persons have so far been discharged. We heard about COVID and pregnancy from Dr. Adish Sirji Singh, the Director of Women's Health in the Ministry of Health, and of course he was urging pregnant women to continue to go to their antenatal or and mother and new moms to go to their postnatal clinics and their baby clinics. He says that the maternity and newborn care services are functional. He also noted that there have been no maternal deaths related to COVID-19 globally and that there have been no significant evidence of transmission from mother to child. And we also heard from Yvonne Lewis, the Director of Health Education, of the Health Education Division of the Ministry of Health, and she gave some guidelines for homes for the aged, which she said is published in the newspaper. Of course, she said the guidelines contain critical infection prevention and control measures. Among those measures, any staff with flu-like symptoms must stay home, and of course that the homes are being urged to limit visitation to essential visitors only. Well, of course, we are being reminded that we must stay at home to stay safe and save lives. I'm Stacey Ann Providence. Bye for now.
This is TTT. Live for local.
It is part 2 of our Wednesday Love concert series. We call this one The Men of Love. So it's an all-male cast serenading you this evening with We have some top-class performances.